What inspired you to come up with this idea of trying to reach out to people and render free health services?
I'm sorry if I will be getting emotional here, but I will just have to give it a shot here.
Was there like any standout story maybe during the outreach?
I tested a little girl of like 15 years, I think, 12 to 15 years, and she came up with a hepatitis B infection.
I would like to know the main objective of this outreach.
To put on the table for local communities free, quality, and accessible medical care.
Welcome to another episode of the Parity Podcast, and today I have with me an honorable guest, someone that did something amazing, and I followed it on Twitter. I was so much interested in it. It was a free health outreach program to some of the most remote parts of Niger State. And I was amazed, even though there is insecurity, he and his team made it to some of the farthest local governments in the state. And I feel it's something that we have to come and talk about and know how everything went, and maybe future insights if they are going to do more stuff like this. So I have with me HS Aliyu, and it's a privilege to welcome you on the Parity Podcast.
All right, thank you, Audu. It's a privilege to be here too.
Thank you. I really appreciate taking your time out of your busy schedule to come here with us. So quickly, we want to welcome you again. I didn't say your name, HS Aliyu. I want you to kindly tell us a bit of your background.
I am Aliyu Haruna Sani. My background is in biochemistry. Had my degree, BSc in biochemistry, with a master's in toxicology and another master's in public health. Currently in view for my doctoral studies in toxicology. I happen to be the team lead for the just concluded Niger State Free Medical Outreach. Thank you.
Okay, so we know the situation in the country, but I would still like to know there are health challenges here and there, but I would still like to know what inspired you to come up with this idea of trying to reach out to people and render free health services.
Actually, this initiative was conceived by the organization ANI, which is the Aspire Alliance for Niger State Youth. This organization, which I'm serving as the chairman, has this conceivement that of providing free quality healthcare services to indigents of Niger State, and with time it will surpass to the entire country.
That's great.
That's our willing. We also have part of our objectives to provide entrepreneurship fund fairs for our entrepreneurs, the youth entrepreneurs in Niger State. We also, in our team, have this part of our objective to improve the quality of education by organizing free teaching outreach.
Okay.
Teaching outreach is in the sense that it will, our members, our professionals will go into secondary schools with the agreement of various principals of secondary schools to help teachers in secondary schools cover syllabuses in different subjects like economics, biology, physics, accounting, and so on. For the medical outreach, as I said, it's not my conceivement, it's a conceivement of the Aspire Alliance organization. For the medical outreach, is a way we can come in for the medical aspect of our aid by providing free and affordable medical services to different communities in Niger State, and as we have done in 11 local government areas, communities that has spread across 11 local government areas of Niger State. The inspiration is that having such kind of gestures for our people will be like a giving back to the community.
Yeah.
And if individuals will come up with such gestures of free and voluntary services to communities, to their immediate communities, or to their locality, I think it will go ahead, it will go a long way into supporting whatever the government provides at the end of the day. Thank you.
Definitely. Yeah. So now you explaining the inspiration behind this movement. You made mention of an association, and at the same time you talked about free educational outreach, which I feel it's something that has not been done. Let me say has not been done in this part of the world. And I feel if you guys should come up to voluntarily, reach out to secondary schools like you said, and try to help teachers there and help the students maybe take off the burden of some subjects. It will also make a lot of sense maybe to chip in. This is just me, my opinion. It will also make a lot of sense to chip in maybe subjects or topics that are not conventional in those schools. Maybe entrepreneurship studies, maybe something that is not there but can prepare students for life after school. Because I feel the syllabus in school right now, we are focused more on studying and not real life scenarios, maybe outside of the classroom. So this is just me saying it that
And
when the time come up for the outreach for the schools, maybe you guys can just chip in maybe some skills, talent, or something to help them discover themselves.
This is noted. It's a very good one.
So that's just it. So now, traveling across Niger State is definitely challenging, and given the local governments that you guys travel to, some of them are very far, and the level of insecurity is high. What were some of the challenges traveling through those areas with insecurity?
Before I go into the challenges encountered during the outreach, I will want to commend the effort of our committed volunteers for this particular project. They were resilient, they were very hardworking, dedicated to the cause. And all of our volunteers were very ready to go anywhere. In spite the security challenges, in spite the economic challenges, they were very ready to go and do this voluntary service, and I give kudos to them primarily. Now, definitely, whatever you come to do, there will have to be one or two things here and there, especially in this economic terrain. We actually face a huge hurdle in terms of financial support. Financial challenges were on us from the start to the finish. But by God's grace and the support of most stakeholders from Niger State, whom I wouldn't want to mention here, we were able to scale through this particular hurdle. I give commendations to Nigerites, both online and offline, that have given us the full support to go through this project successfully. And I say thank you here. I'm using this opportunity to say thank you here for that gesture.
Yeah. Now back to the outreach. What was the main objective? What were you guys? I know maybe there are a couple of solutions, health solutions that you guys can grant one time, but I would like to know the main objective of this outreach.
The objective of this outreach is to put on the table for local communities free, quality, and accessible medical care. The healthcare services to be provided to them at free, accessible, and it should be of high quality. That's one objective. And we were able to do this by going to them with this free medical care, thereby removing the barrier the financial barrier that is between the local communities and health attention, seeking health interventions. Most of these localities, most of these individuals, it is the finance that is stopping them from going into the hospital to check on their health. We, by our own outreach, were able to remove this barrier. Again, our outreach will serve as a tool for early detections of diseases and probably prevention of diseases. People in these communities, in rural areas, will have early know-how, the knowledge of what they are infected with, the diseases that are prone to them, and with this, we'll be able to have easy prevention methods to avoid these diseases for people that don't have. For instance, the vaccination. Most of the primary health facilities in the communities we visited were actually cooperative by providing us with vaccines, especially for hepatitis B, where most individuals, especially the adult group, were vaccinated with hepatitis B vaccine. This vaccination will serve as a protection for these individuals for life against hepatitis B. This is another objective. Again, the health education. We were able to create awareness on health, generally health. People in these communities will have more knowledge, know-how on what is happening to them, what symptoms they are exhibiting, and we are giving advices on healthy attitudes to life, healthy ways of life, healthy behaviors of life. This is also another objective that we're able to surmount during the course of our outreach.
Yes, thank you for that answer. Now, I saw a lot of pictures while you guys were out there, and from what I saw, most of the communities kind of welcomed you guys really well. Was there like any standout story, maybe during the outreach, a standout story that maybe, or a moment that you keep that has resonated with you and you want to share it?
Yeah, there are a few moments actually. Personally, it happened to me at Payoko, where I'm sorry if I will be getting emotional here, but I will just have to give it a shot here, where I tested a little girl of like 15 years, I think, 12 to 15 years, and she came up with a hepatitis B infection. This girl got the results and went home, and a few minutes later, she ran back with her aunt, crying, and her aunt explaining to me that the reason why the little child was crying was because her dad died of hepatitis B, and she was aware that it was hepatitis B that led to the liver infection that caused the death of her dad, and that's why she's crying. I was so emotional at that point, to an extent I had to take up from there. I have to get her in touch with a specialist to arrange a referral for the young lady so that her health will be put into attention, especially that she is aware of the effects of what hepatitis B can do to any woman. And I think that got me, one of the moments that got me during the outreach period.
Okay, that's quite emotional. Maybe was she aware? That means before you guys were there, she wasn't aware of
her status. Yes.
Her status.
Yes.
Yeah. That's why I picked interest in this thing, because I know there are stories that we probably
of course I was looking at it to be like some kind of inherited trait.
Okay.
Her hepatitis B could be inherited from her parents, but she hasn't been tested yet since, and she just got to know. So I think such kind of gestures of outreaches, medical attention should be given to the communities in order for us to have a healthy community.
Yeah, I get to understand, but sometimes from people from our side of the world, they hardly go to hospital to maybe check their health and maybe try to just see what is wrong with them. So I feel if we can have more of this type of outreaches, it will definitely help in detecting early infections and diseases, just like you said. And I also like to know, I know this is definitely not the end of the outreach. You guys travel to 11 local governments, and there are more local governments. We have 25 here in Niger State. So what are the plans to expand to all those places?
Actually, as assigned, as the team lead for the project, I faced the committee, that is the committee that set up the outreach. After giving me the team lead, I faced the committee to tell them that we are going to the 25 local government areas. There had to be some people that have to stand up to me to say, no, we have to look into the security challenges of some areas and bring it down. And the number was brought down to 11. Yes, of course, we intend to go to the 25 areas in Niger State, and very soon. And not only in Niger State, we are making efforts to go outside Niger State, actually. And when this materializes, it will only be a matter of time that you will see many other associations, many other voluntary organizations coming up with such kind of gestures, initiative for free medical outreach. It's a good thing that when you see things that are good, you embrace. And when you embrace it and practice it, it's fair, it's healthy. So we are calling on professionals, we are calling on individuals, stakeholders, youths to come up with such kind of initiatives. It could be health-wise, it could be education-wise, it could be anything that will bring development to the community. We mustn't keep waiting for the government. We should do what we can do in our own simple capacity, in our own little way. These bit by bit actions from individuals, when you put them together, it culminates into something major, and it will give a good impact on the community and the society.
So, like, traveling across the state, what was let's say, the major disease or infection that you guys encountered?
Many people have been waiting for this particular response, especially on Twitter. Many people have been messaging me to ask,
let's answer them.
Yes, what is the prevalence? What is the disease that you saw in my location, in my locality, in my local government? I said, you have to calm down. These things don't do themselves. We have to do it gently, then we analyze it.
Yeah.
Our outreach made a huge impact and it's a huge success in the sense that we were able to come up with some research findings. And because of these research findings, our committee at the Aspire Alliance are already into seeing how these reports will be documented and how these reports will be published in a reputable journal, a scientific or health journal, for the sake of reference and also confidentiality. After our outreach analysis came in, we have, permit me to look into my results sheet.
You are free to.
We have some discoveries. Actually, we will, at the board level, at the committee level, want to tag this 2024 outreach, Niger State Free Medical Outreach, as the 1899 outreach. We now call it the 1899 outreach at the board level. The reason why we call it the 1899 outreach was that we had a turnout of 1,899 individuals, beneficiaries, for these 11 areas we have visited. And Kwantagora happened to produce the highest number of participants, beneficiaries, which culminated to about 22% of the population we actually covered, which is exactly around 417 beneficiaries. Also, slightly followed by Bida local government area with 201 beneficiaries. Out of these beneficiaries, that is the 1899 beneficiaries, we have females having 64% of turnout. We have the highest percentage in females. Females have 64% turnout. Then for aged people in our research, our project, we had 31% aged people from 50 and above age, and we have adults of active age from 18-35. We have adults of active age comprising 59%. Actually, like I told you, the Aspire Alliance is an organization for the youth, and we are up and looking out for the youth. Even the hepatitis B infection and the hepatitis B vaccination that I mentioned earlier, we are targeting the youth and children, because a youth is the one that will go from here to here, from corner to corner. of the world. And with this vaccination or infection of hepatitis B or any disease whatsoever, it will be a challenge. So the youth are part of what we are looking out for. So from our statistics, we have the youth having up to 59% of the turnout of the overall 1899 individuals. The preventable diseases we have, the health indicators that we have reached out, we have tested, we have screened, which comprise the hepatitis B, HIV test, blood pressure, that is for the hypertension screening. We also have the malaria parasite test for malaria, and we have the fasting and the random blood sugar test for diabetes mellitus. For hepatitis B, Boso local government area had highest percentage of positive samples, with 15% of the turnout to be positive for hepatitis B. And for HIV test, Suleja local government area had the highest percentage, with 7% of the total turnout in Suleja for HIV test. Well, Wushishi, Chanchaga, Bida, and Payokoro had a negative turnout. That is, the complete number of people from this local government were negative to HIV test. Hypertension, Suleja, Aguara, and Lavun local government areas had high levels of hypertension rates, that is, the high levels of stage 2 hypertension, and Lavun has the highest level of the crisis, that is the hypertensive crisis, from our record from the outreach. And malaria parasite test, after the malaria parasite, Wushishi local government areas turn out to be with the highest rate for malaria from our outreach. Then the diabetes mellitus turnout rate, which is up to 86% high. 86% of the aged people that were tested from Agaye local government were actually having high levels of random and fasting blood sugar tests, which is an indicator for diabetes mellitus. I think this is just a snippet of our results, and I think with this you have a dimension to where the health indicators are taking us to. We implore stakeholders, organizations, the government, to look into this and probably come up with formulations or policies or interventions according to this particular disease report.
Yeah. So according to your data, you at the various places that you travel to, you had more women turn out for
Yes.
the test.
Yes.
What do you think makes it that way? Maybe is it because there wasn't enough publicity, or maybe young people are not just young men are not just generally interested in checking?
No, like I told you,
status?
adults, where the young men category sits, has the 59%. It's just that the women had highest rate than the male, in the sense that it's understandable that most of the times we're in the areas, probably the males will be at the farm or at workplaces, and the women that are around will be mobilized to come out for the medical outreach. So it's understandable the males probably be at the farm or at their workstations.
Me personally, I just feel maybe you guys publicize quite a lot, and I was following up on Twitter. I know everywhere that you guys were going because you guys kept us updated. But I still feel for the remaining LGs, there should be publicity, more publicity. I feel publicity is never enough, and whatever medium that you can use to publicize something like this, and this is something that some people that you guys are taking it to might not even have it for their entire lifetime. I know what I'm saying. I know where we came from, like how it can be. So I feel this is an opportunity for them, for people in the most remote places that you guys try as much as possible to reach out to. It's very important for them not to miss it. So I feel publicity should be improved,
of course,
so that they will get a lot more numbers. And this your data is very important, and the data can be so big and so large that when somebody is working with it, he know he's working with maybe data that has been collected from a large volume of people. And I'm sure this data should be used to improve the level of healthcare, and depending on maybe the type of problem or infection or disease that you discovered in a particular area, stakeholders and government should probably use the data and set up healthcare facilities that will cater to these specific problems.
Yeah, I think I go with you. I agree with you in all sense.
Yeah, so I also want to ask something quite important. How did you guys measure the success of your outreach?
You see, when you are a student and you are undergoing a project research, you begin to measure the success of your research by being ready for it. How? You will first and foremost come up with a template. In the academic setting, that's what we call proposal. A proposal will comprise from A to Z of what you are intending to encounter. For our outreach, the committee of the Aspire Alliance has already designed the template of how a recognizable free medical outreach is supposed to be carried out in Niger State. With this template, from A to Z, that is from getting the volunteers, advertising, publicizing, sourcing for funds, going into the field, doing the research, traveling to areas, taking samples, coming up with the results, documenting the results, giving a report of what you have gotten as a result, up to publishing the report has already been carried out, has already been compiled and covered in the proposal for this particular free medical outreach. That's the first area where we are noticed. We are notified of the success of this outreach. And now we are here, done and dusted with the outreach. And the template was followed from A to Z, and there is no any untick. Every box has been ticked accordingly. So measuring our success in respect to what we have already given out from various areas we've gone to, how people accommodated us, how people turned out, how people showed interest, enticed us, how people were ready to go with us, to come with us, to advise us to continue this initiative. This is a success story. This has given a highlight to us that people are interested in such things. Most people confess that they have not been this kind of things. In fact, if we approach areas, people think it's government.
Definitely.
We have to tell them, sit down. This is this, this is that. There are things we can't do because this is not government, this is we.
Yeah, as individuals.
So, as individuals, there are things that we will do for you because we just want to do it for you and not publicized and not political. You understand? So, the success rate we have recorded was very open. It was shown to us from people we have interacted with, people that benefited from this particular outreach. And now, the result we are having is a touchlight for any serious government or any policy maker or any serious stakeholder in the health sector. Seeing our results will give him an interest to know what is happening and an interest to provide interventions to these areas as highlighted already. So it's a huge success, sir.
Yeah, so one thing is carrying out projects like this is definitely financially, it's not something I'll say that is cheap. Did you partner with any local organizations or maybe individuals, or maybe did governments come to support in any way?
Yeah, at the beginning we struck a deal of partnership with the NICARE, Niger State Health Contributory Agency. Apart from that, we, in most cases, like in few local governments like Kontagora, we liaised I'm partnered with some stakeholders in such areas, like the Commissioner for Community Development, Honorable Falalu. We partnered with SMA, that is the House of Representatives representing Bida Baku constituencies. We also partner with another foundation in Wushishi. That is the Katuka Foundation in Wushishi, and so on. So it was not thoroughly an individual effort. It was in partnership with different sectors, different segments of people, either agencies or stakeholders or political office holders.
So if individuals, if people like me want to support this your outreach, or maybe organizations, is there any way they can reach out to you guys for support? Because I believe the first outreach that you traveled to 11 local government, there was no, maybe you guys did not make any post on social media, maybe seeking for people to collaborate with. So if there are channels we can use to support you guys, how do we get in touch with you guys?
Yeah, actually for now, we are not very dense on social media. We're only occupying Instagram and Twitter, then maybe Facebook. Well, subsequently, we are supposed to open our official account in all of these media outlets, so that we'll be able to reach a larger array of the population, where that people that are interested in sponsorship, partnership will easily find us. As it is, we are actually open to collaborations from all, from stakeholders, from agencies, from NGOs and CSOs.
Okay. So like you, maybe okay, who will I reach out to? Who will I message? Maybe on social media, or maybe phone call, or anything.
Actually, on social media, we have an account on Twitter, which is for the Aspire Alliance for Niger State Youth account. We also have an email that easily collects all information that is for us. I, being the head, will, from now subsequently going forward, will create some outlets or platform or accounts to ensure that people that want to get to us reach us, not individually but using an official account. But for now, actually, a lot of people that have shown interest either to volunteer in the next activity, or a lot of people that have shown interest in being members of the Aspire Alliance are actually reaching out to individual accounts or membership accounts like mine and all other of my ESCOs.
Yeah, I think all the information you are going to provide with me after this session is over, maybe you have to give me the email, because I'm going to put it in the description of this podcast. Okay. So anyone that wants to support you can just get in touch with you easily.
Okay.
Yeah, so now I'm sure this is not the end. I think this is just the beginning of the outreach, and I know you definitely want to make it bigger than the first one. What are the plans? We would like to know that.
Yeah, actually, a lot of people have been asking about the outreach. Why did we stop? Why have we finished so early or so late? We should continue such things. And I tell them it actually has to do with organization, planning. When your plan is well executed, you take a rest. Actually, after this particular first, there is the pilot pilot outreach. This is just the beginning. This is the starting point of good things to come. And I assure our supporters and people that want to join us to belt up, because we are already on the verge of undergoing one of the biggest outreach in Nigeria.
It's possible.
We start here, but tomorrow will be very wide across the country. I think what I can reveal to people now is that they should just watch out for us. We are coming bigger.
That's what we want to hear. So finally, this is going to be the last question. What advice would you give to people? Earlier, you made mention of individuals should try as much as possible to go in, maybe even if it's the health, it's not like competition or something. everyone should try as much as possible
Yes.
to contribute to the
Yes.
community so we get the developments. We don't really have to wait for government. What advice do you have for individuals maybe that have this interest in mind, but they don't maybe have the confidence to go out and start? What you might say here might just be what will spark the plug in them and they will be confident enough to start. What will you tell people like that?
The individuals that are interested in this course, all I can start to say is you have to start. However little, you just have to start. Whoever you see have confidence today or have a huge project executing today, he started somewhere. So the moment you start, I actually started from my own community. I was just out of school after my NYSC, and I began this free medical outreach for my immediate community. At that time, I only do fasting blood sugar tests for my community, people in Kwangila area of Mina. I actually grew up in Kwangila, and people in Kwangila know me with doing free medical outreach, probably during when I'm celebrating my birthdays or any day I'm in the mood, things like that. So I think we have to just start somewhere. We never expected or thought it would be this easy as we saw it. People were actually seeing it like a very Herculean task. But when we started, we became fond of it, and we began to partake with interest. And before you know it, we are done with it successfully.
Yeah. So I wish you all the best for what the plans that you have, and I would like to see them actualize.
Inshallah.
And I'm sure this is not the last time we are going to come back and sit with you.
Inshallah.
I know you guys are definitely going out there again, going to get more stories, more success, and by the grace of God, you'll be back here with us and share everything with us.
Inshallah.
It has been an honor having you on the Priority Podcast.
Thank you for having me. Thank you so much.